Hello there. My name's Anthony Pasidi. I'm a member of Team DeMold for the Stevens Institute of Technology MIS 699 Emerging Technologies course. Think about someone who's been sick in your life, somebody who potentially has been stricken with cancer, and the pain that they ultimately went through in order to get their treatment. Now think about how we can actually fix that. Think about taking medicine that won't harm your body, but ultimately go to the areas of your body that it needs to help, and ultimately, in fact, do that. What I'm talking about is personalized medicine and smart drugs. And as you'll see in the continuation of this presentation, what its implications are providing as it becomes an emerging technology or emerging capability in the healthcare field, and ultimately how it can provide a true sunny day scenario in the near future. Now I'd like to get specifically into our topic. Our topic as a team was personalized medicine and smart drugs. And as you can see, team members are the following. Paul Dykstra, Anthony Pasidi, Marcia Stanton, Kobe DeGraff Johnson, and James Jeffers. So what is personalized medicine? Personalized medicine refers to a medical process where healthcare is customized and tailored to each individual patient. Specifically, there are medical decisions, practices, products, and drugs that are individually designed for each patient and the use that they need these drugs for. There's a use of technology or discovery which enables a level of personalization that was not previously feasible or practical. Diagnostic testing is commonly used in order to select the appropriate therapies that are necessary for personalized medicine techniques. And one of the big advances with personalized medicine is the use of genetics and how that genetic information plays a major role in its growth currently and in the future. As for the other topic, smart drugs consist of a specialized set of drugs that can adapt to the individual's needs of a patient's treatment or therapy. Smart drugs specifically are able to identify and target specific cells or parts of the body where drugs are specifically needed. In this case, it minimizes the side effects on the other parts of the body and cells that current medicines address. So when you're taking something like Tylenol, you're using it for a specific part of your body, but by the time it gets to affect that area of the body, it could have dissolved in other areas of your body, and minimal effects will actually affect that area, such as if you have knee pain. Specifically with smart drugs, targeted drug delivery is a method of delivery that improves upon what I just spoke about. It's a delivery of medication to a specifically to a patient in a manner that increases the concentration of a drug to a specific area. The goal of smart drug delivery is to prolong, localize, and target the diseased tissue while minimizing harm and damage to healthy tissue. Profound interest in smart drugs and targeted drug delivery is currently in the field of cancers. It's also been explored in diabetes as well as heart disease. So what were the driving forces behind this scenario planning project? First, legal. So legal liability, it's pretty much a powerful driver with personalized medicine and smart drugs that could dramatically hasten or slow the development of personalized medicine, especially with regards to lawsuits. Second, we have regulatory information here. So they're likely to have a significant impact on the evolution of personalized medicine, as the regulatory environment has not kept pace with rapid advances in the field of personalized medicine. Next, we have ethics. So keeping with the Hippocratic Oath of physicians, they're obligated to do no harm, yet prescribing practitioners would usually have no way of knowing in advance whether a drug they prescribe will actually harm a harm a patient. So ethical issues include the accessibility of tests to patients and whether tests will be available directly to patients via the internet or over the counter. Next, we have politics. So we're not really sure what effect personalized medicines and smart drugs will have on insurance providers, especially with regards to Medicare, Medicaid, and or Obamacare. Next, we have society. So the most intractable obstacle is misaligned interests and incentives. So what are the technologies that are driving personalized medicine and smart drugs? Genomic technologies have been central to achieving the promise of personalized medicine. Current technologies with regards to genomic technologies is genome testing, which is the analysis of genetic variation, mainly focused in DNA and how to evaluate DNA structures and the analysis of gene expression through microarrays. Now, the challenges between genomic and clinical data is currently being realized with regards to how to store, process, and analyze the massive amounts of data that's being captured from these genetic tests. And what's actually helping that is actually big data. So if we remember the Gartner hype cycle that we were to look at the first 2 weeks of the course, big data is helping advance the processing of these genomic data elements, as well as imaging data from sequencing methods. Other technology-based driving forces that we found in our research is 3D printing, specifically from a company called Organovo, or OVO. And this is pretty much being explored with regards to 3D printing of tissues and organs. There's a company out there right now that is exploring printing 3D working versions of kidneys as well as livers, and that'll be driving key driving forces moving forward. And overall, top vendors with regards to the technology and the growth in personalized medicine and smart drugs are Abbott Laboratories, AstraZeneca, Hoffmann La Roche, Novartis, Pfizer, and Sanofi SA. So let's take a look at our scenarios, first starting with the sunny day scenario. This scenario, as well as the rainy day scenario, will be broken into 15-year increments. Those 15-year increments broken into five-year segments. So let's start with years 0 through 5 for the sunny day. Consumers and doctors will see smart drugs as a desirable mechanism for preventive medicine. Medical schools will obtain funding for research, and new drugs will be developed and tested in late trials and ultimately be approved by the FDA. With regard to years 6 through 10, doctors will obtain limited liability insurance for protection, which will be substantial in them continuing practice. Smart drugs will be explored for oncological training, which will result in preventing cancer. And the FDA will be able to approve groups to receive targeted care. And lastly, regulations enacted to prevent insurance companies from charging higher rates will be established, and overall testing will become standardized. Years 11 through 15, long-term benefits will be realized with insurance companies and for overall diagnostic testing. Privacy initiatives surrounding personal genetic information will be met. Targeted medicine overall will become widely adopted outside of the field of oncology. Smart drugs will become widely adopted and profitable, invoking further researching. And the first cure for pancreatic cancer will be discovered with the use of smart drugs. So what about our rainy day? So what about the rainy day scenario? Let's look at years 0 through 5. Small number of consumers will see the benefits of smart drugs. Doctors will remain skeptical in using them. And medical schools, while they'll have funding for delivery mechanism research, Overall, smart drugs will continue to face hurdles in research and development and FDA approval with regard to late-stage trials. Years 6 through 10, doctors' liability insurance will become more expensive due to unknown risks in overall success. Medical schools will adopt strategies for implementation of smart drugs, but doctors will abstain from training, ultimately due to the lack of value throughout the field. Smart drugs will prevent cancer in a few high-risk individuals, but low numbers will result in FDA lack for continual approval. And diagnostic testing will remain unstandardized. And lastly, years 11 through 15, insurance companies might start to finally see long-term benefits in covering diagnostic testing, but ultimately will remain unsure in the percentage of individuals the medicines will work for, as well as the cost of long-term care for high-risk individuals. Existing compliance measures won't be fully able to comply with privacy initiatives for personal genetic information. No prevention for insurance companies from charging high premiums will continue to exist. Targeted medicines will not become widely adopted outside of the field of oncology, and ultimately no cure for cancer will be found. Lastly, the last thing we want to show you is our influence diagram that determined our scenarios based off of our research. You see the smart drug is the center point here, and 3 branches. The consumer seeing the benefits, but general practitioners are skeptical. General practitioners and the consumers ultimately seeing the benefits. And the effect of research and development on the general practitioners and consumers seeing benefits. Based off of the track here in the influence diagram, you see the difference between limited application and ultimately the cure for cancer. And lastly, on behalf of Team DuMold, I'd like to say thank you for your time in listening to our presentation on personal medicine and smart drugs.